Good morning.
Good morning.
How are you today?
We're good.
All right, great. So I'm Jill Miller-Zyman. I'm the Project Director of Efficient Gov Network, and this morning I'm speaking with...
I'm Phil Kouwe with Emergency Services Consulting International.
Thanks so much for taking a few minutes, Phil, to speak with me this morning. So can you say a little bit about the work that you do?
Emergency Services Consulting International is a public safety consulting firm, so we just do consulting on law enforcement and emergency medical services, fire departments, and public safety communications. And our primary product is fire and EMS.
Great. And so this morning I wanted to hear a little bit about the work that you've done with a group of communities that are on the west side of Cleveland. If you could just say a little bit about the project you've worked on with them and how many communities are involved.
We were working with originally 7 communities that are part of the West Shore Council of Governments. That's a suburban area on the west side of Cleveland, as you mentioned. Actually straddles part of Cuyahoga County and the next county to the west. Subsequently, there was another community that was added into that project as well. So we ended up with actually 8 being at least some part of that community. The primary focus of the project was the feasibility for shared services, looking at determining whether it was feasible to put those fire departments together into a single unified regional fire department, or to look at some potential functional consolidations that might be able to be accomplished.
What are the main criteria you look at when you are doing a feasibility study? I'm sure there could be tens or even hundreds, but what are the primary, say 5 to 8 or so, if there's that many?
Well, the criteria that we look at, I think that's a good place to start, is when we do a feasibility study, the whole point of the question is, does it make sense, or is it feasible to even look at moving forward with this? And for our purposes, feasibility comes down to very, very basic, what we like to call our litmus test for feasibility, and that is we either want to be able to improve services at the same cost that's being paid now, or we want to provide the same service at less cost. So the idea is that for the bigger bang for the buck, if you will, if we can take the same money we're paying right now and do a better job of providing services, then that would make a consolidation or shared service option feasible. If, on the other hand, we can continue the same level of services, if that service is completely satisfactory to the community, but do it for less money and save money, then again, it's the bigger bang for the buck theory. If we can't, obviously it'd be great if we can accomplish both. If we can decrease cost and improve service, that would be a total bonus. But if we can't accomplish one of those two things, then we would typically consider it to be not a feasible option. There are times when we also would consider something to be conditionally feasible, meaning that we believe there is efficiency to be gained or savings to be had, but certain things have to be accomplished before you're going to reach that, or before you're going to achieve that, or it's dependent on a very specific set of assumptions that would have to be met in order for that to occur. So that's kind of the basic concept. Now, in terms of the actual studies themselves, we really focus on 2 areas, and that is looking at organizational mergers, or taking multiple organizations and merging them and becoming a single organization. And that's what we call, obviously, either a merger or an operational consolidation, depending on how the governance model is set up. And then the other thing that we look at is functional consolidations, meaning that, okay, if we're not going to put these 2 or 3 or 4 fire departments together into a single organization, are there functions that they could perform together? Functions that every organization or every fire department has to perform, like training and communications and maintenance and fire prevention and public education and standard operating guidelines and all these other functions that a fire department has to perform, that they could do together, and that would be more efficient or effective, or even save some money. So those are kind of the 2 areas that we look at.
And in a thumbnail sketch, where did you end up with the West Shore COG? I have looked through the report. I know it's really lengthy, so I'm I'm not sure just how much of a thumbnail sketch you can give us, but in general, what were the basic conclusions?
Yeah, that's some good light reading if you want to read that right when you're trying to get to
How
sleep.
many hundreds of pages was it?
Yeah, I think it's 200 or 300 pages. But in a nutshell, what it really boils down to is that it is feasible for those departments to merge together and become a unified regional fire department. It would be obviously very unusual for the state of Ohio. I don't want to say it would be a first, but it would certainly be among one of the first major mergers or consolidations.
Has the news drifted down to you that last week the mayor of Cleveland announced that they're going to consolidate Cleveland's fire and EMS?
Yes, we had heard that. Yeah, Cleveland Fire and EMS going together, right. And that's not a terribly unusual first combination for communities to make.
I'm sorry I interrupted, but yes.
Yeah. But with West Shore, it is feasible for them to become what would be a pretty large regional fire department. But it's also feasible for them to do some functional consolidations as well. So if along the way they ultimately decide that legal merger is not the direction they want to go, I think there's a variety of functional consolidations that, quite honestly, they're already working on just as a result of the report. The fire chiefs themselves are already undertaking some of these things. And so there is a feasibility there, and they have actually moved from the feasibility phase into what we call the implementation planning phase.
And that's where they are right now, right? Where they're talking amongst themselves and poring over the report and deciding which things they feel they can act on?
Correct. And I think it's really important for your viewers to understand, at least from our perspective, and we've got a lot of experience at this. We've been doing consolidations and merger studies since the mid-'70s, but from our perspective, they are very distinct phases. The feasibility phase is not the phase where you flip the giant switch and make a decision to merge. Feasibility is really the process of determining whether something makes operational and financial sense, or that the projections at least look like it will. The implementation planning phase is the next phase, where you really, the local group gets together and starts to plan out how they're going to bring that about. All the details and all the committee meetings and subcommittee meetings and so forth and so on. And that can go on for a year, 2 years, even 3 years. We've seen it go on. And then once that implementation planning is done and you have all the details of that implementation planned out, that's when the elected officials get to put their shaking hands on that big giant switch and pull it and energize the whole thing and make it happen. That's the final decision point. What comes after the feasibility analysis really is just the decision as a matter of public policy whether a community wants to invest the time and the energy of their staff in pursuing a particular avenue. And that's really, because it's a huge undertaking.
Massive.
It takes a tremendous amount of undertaking. And before you decide you want to move your staff forward in that, I think the feasibility analysis and saying, yeah, it does look like we could save some money, or yeah, it does look like we could make some better decisions or better efficiency. So let's direct our staff to move forward and invest in the implementation plan. Ultimately, you get the implementation plan done, you may decide, after looking at the way that we've negotiated and compromised and all that, and the way this has come out, maybe it's really something we don't want to do. But that's totally separate than determining feasibility.
Got it. So what would you say ultimately when it gets down to brass tacks, both in the feasibility phase, which I'm going to guess you're more familiar with, and the implementation phase? What are the one or two things you believe tip the scales towards feasibility and implementation, and what are the things that you've seen present that tip away from a merger or a sharing of services being feasible and getting implemented?
Well, oftentimes the feasibility analysis simply determines that there is not going to be a significant cost savings for folks. And if that's the primary driver of the study, then that's oftentimes pretty disappointing, and they decide not to move forward with it. But that's why you do a feasibility analysis. We go in all the time, and we start a study where someone tells us, hey, we've done some basic calculations, and we think we can save $750,000 if we put our fire departments together. And we come back after the feasibility analysis and say, hey, we think you can save $87.39. And they're dumbfounded. But it's because they don't understand all of what goes into costing out a fire department and its operations. And they also don't understand that when you put fire departments together, there are going to be some changes that have to be made. If one department has its pension funded this way and another one has its pension funded that way, and so forth and so on, when you get all that calculated out, and I think that's where, experience of a third-party company like ours is really good, is that you come in and you say, hey, the savings isn't going to be what you thought it was going to be, and oftentimes we will come back and say the savings isn't there, but you're going to have some significant efficiency improvements. Sometimes they'll decide, yeah, okay, that's worth going forward with. But honestly, if their main objective was cost savings and they don't get it, they sometimes decide not to move forward.
Right.
Other times you will have political or governance or control issues that will just get in the way, and you realize that you have two totally incompatible cultures as organizational cultures are so completely different that you have to say, hey, this may be feasible, but it would be conditioned on the fact that you've got a lot of blending of organizational culture that would have to take place. Now, on the plus side, reasons why people do it is because oftentimes what you'll find is that blending the organizations will allow you to decrease the administrative and support costs and either reapply those into true operational costs or save money.
One thing that I learned last week, we interviewed a gentleman named Gene Nixon, who is the commissioner of the Summit County Public Health District. And they're a county-wide health district that over the last 2 years have kind of subsumed the city of Akron and the city of Barberton. And that took some time, but it's working out really well. And one of the things that I heard from the people there was that the consolidation that they've done and the sharing that they're doing has actually added flexibility to service provision that had not been there before. And that was not something that I had ever really heard come up before. And I'm wondering, do you find that as well in the fire and EMS area?
Yeah, oftentimes what we find is that cities want to merge, let's say, three very, very lean fire departments that are running extremely lean, just about starving to death as an organization, and they want to merge those and see a cost savings. And we always tell them, look, cooperative service in the fire service, that's not like the biblical 5 loaves and 3 fishes. You're not going to, maybe it was 2 fishes, now I don't remember. Anyway, the point is, you're not going to create something from nothing. So if you take 3 very lean fire departments and put them together, what you'll probably end up with is one very large lean fire department, and sometimes it's hard to find savings out of that. But if you've got those 3 organizations that have wanted to make some improvements and simply did not have the money to put into the operations to improve it, if you put the 3 departments together, you'll find oftentimes some administrative and support cost that can be saved and reinvested into improving operations. We're doing a study right now that involves actually looking at the potential for cooperative service or some kind of merger or consolidation of 21 fire departments in a county.
Wow.
And in that particular case, there is a massive amount of money being spent on 21 fire chiefs, 40-some assistant and deputy chiefs, all of their staff cars, et cetera, that goes with it. And we're saying, hey, if you put that together and you were able to run a regional fire department with a reasonable number of administrative assistant chiefs and deputy chiefs and so forth, battalion chiefs, a lot of that money could be moved over to operations and actually improve a lot of what you're doing. Put more firefighters on the street, actually. In their case, which they could use. And I think that's what oftentimes gets overlooked, is that it's a smarter way to use the money, not necessarily always saving it or putting in the bank, which is, I think,
Right.
in a lot of cases what they're after. But oftentimes there are some really smarter ways to use that money.
Well, what we're really talking about is aligning our resources, meaning the revenues, with our needs in a way that makes everybody happy. So both the people who work and the people who are governing and the people who are getting the services. So thank you very much for your time this morning, and I look forward to getting feedback on what people hear. I find the way that you talk about it very encouraging, and we're hoping that others will as well. So thanks so much, Phil. And have a great morning.
If there's anything else we can do for you, just give us a shout.
All right. Thanks so much. Take care. Bye-bye.